Tell me if this feels familiar. You finish urinating, you're standing at the urinal, you zip up, and then suddenly, a little more urine leaks out. It's incredibly frustrating, right? And let me assure you, you're definitely not alone. I hear this concern from patients all the time. I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to discuss that bothersome urine leakage that occurs right after you think you're done. So, what do we call this small amount of urine that drips out after urination? It's known as post-void dribbling. When we look at research, several studies have tried to measure how common this is, and the numbers vary widely, from about 5% of people to nearly 58%. From my own experience, I'd say it's likely much more common than the lower estimate suggests. There are a couple of theories behind why this happens. The first idea is that if there's some kind of abnormality in the urinary tube or urethra, such as a narrowing, urine can become trapped behind that tight area. You might pass what you can during urination, but some urine stays behind and then leaks out afterward, once your bladder has used all its force to push urine through. The second explanation, which I believe is more common, involves something called prostatic urethral trapping. The prostate is a walnut-shaped gland located just below the bladder, surrounding the urinary tube. As it grows, it may make it more difficult for urine to pass smoothly, allowing some urine to get stuck in that region. What happens during urination is easier to understand when you know that men have two sphincters. One sphincter is located at the bladder neck, right where the bladder connects to the urinary tube, and the other sits just below the prostate. When you finish urinating, the bladder neck closes. But if all the urine hasn't fully passed through the prostate area, the external sphincter can close as well, leaving some urine trapped inside. Then, as soon as that external sphincter relaxes again, the leftover urine can leak out. The current thinking is that there may be some neuromuscular dysfunction involving the muscles around the urethra, including the bulbocavernosus and ischiocavernosus muscles. These muscles normally contract to help push urine forward. But when they weaken, which can happen with aging or certain neurological conditions, it becomes more difficult to fully expel urine all the way to the tip of the penis during urination. So, what can you do about this frustrating problem? If it's caused by a narrowing in the urethra, you might notice that your urine stream feels weak. It may not flow strongly, and you might have to strain or push. Some men even notice that the stream sprays or splits in different directions. If that sounds familiar, it's important to schedule an appointment with a urologist so we can evaluate whether a stricture is present and discuss treatment options. If you have an enlarged prostate, there are several symptoms you might start to notice. You may find that your urine stream is weaker or that you have to strain or push to get started. Sometimes the stream takes a moment to begin, or it may stop and start while you're going. You might also notice increased frequency, feeling like you need to go more often than usual, or urgency, that sudden gotta go right now feeling. And very commonly, many men find themselves waking up multiple times during the night to urinate. If you're experiencing these symptoms, it's important to see a urologist and get proper treatment. In many cases, once these underlying issues are managed, that post-void dribbling, or that small amount of leakage, often improves as well. Now, if you're not dealing with any of those other symptoms and only notice this slight dribbling, you may fall into a category where mild muscle dysfunction is the cause. So, what can you do about it? The first step is simple and something you can do right after you urinate. It's called bulbar urethral massage. To do this, place your fingertips about an inch behind the scrotum and gently press upward toward the base of the penis. Apply steady pressure, and this can help push out any urine that's left behind. Doing this once or twice after urinating can help clear that last bit. You can also try gently stretching, squeezing, or shaking the penis to help remove any remaining urine. Another helpful approach is strengthening your pelvic floor muscles, commonly known as Kegel exercises. I've talked about these before, but many men find them challenging. First, because no one really teaches how to do them properly, and second, because it can be difficult to tell if you're actually doing them the right way. So here are a couple of ways I explain it to men. First, it's similar to the sensation of stopping your urine flow while you're peeing, but you don't actually want to practice it during urination. Another way people describe it is like trying to lift your penis without using your hands, engaging those muscles to raise it against gravity. When you perform these exercises, aim to tighten the muscles for about 5 seconds, then relax for 5 seconds. That relaxation phase is just as important because if you stay too tense, it can actually lead to more discomfort or problems. If you're dealing with any kind of pelvic pain, pain during ejaculation, or testicular discomfort, I wouldn't recommend starting these exercises without first speaking to a urologist or a pelvic floor physical therapist. I hope you found this helpful and informative. Let me know what else you'd like to learn about. I'm Dr. Rena, urologist and pelvic surgeon, and always remember to take care of yourself because you're worth it.